somebody can stand, we want them to stand and do this because they're engaging all aspects of their body. Lots of reasons they would need to sit, whether in a wheelchair or maybe completely new to exercise and really just getting started or have an injury. Maybe talk about some of the reasons, and how Excy would work from sitting from a chair and why you would use a chair.
Yeah, I mean, I think in general with the rack system, if you can do it standing, you probably want to do it standing.
Yeah.
Now, I mean, there's going to be situations where that's not possible. And, and I think this is a great way to maintain fitness, get your heart rate up. I mean, if you're post ACL and you're 2 weeks out, you're not doing a whole lot to stress your cardiovascular system. So I think this is a great alternative. Anything lower body, this is a fairly safe position. If I bring my chair in closer, I can quite easily get a good workout here. I can adjust the resistance as I need to, make sure that I get my heart rate up. And I think may have talked about this earlier, but your cardiovascular benefits of doing upper body ergometry rather than lower body, you're going to burn a lot more calories, your heart rate's going to get up faster, blood pressure is going to get up a little bit higher when you're using your upper body compared to your lower body.
Absolutely.
Right, so if I'm trying to achieve somebody, let's take a patient with lumbar stenosis, and their capacity to stand is 5 minutes, but that doesn't do enough to kind of stress their cardiovascular respiratory system. You can have them sit, use this here for 10 or 15 minutes, however long, and you're going to get a much higher benefit of using their cardiovascular system rather than them doing some type of standing exercise.
Absolutely. And then just the benefits of when you have a torn ACL, a broken leg, or sprained ankle, and you just can't do anything.
A lot of times with our patients, they come in and they're obviously focused on their knee, right? And of course, but we're going to try and do as much as we can with the rest of their body to try and maintain their fitness. I mean, I see this as a good alternative. I mean, you're working a lot of different things all at once, right? I mean, we're getting some strength, you're getting some blood flow. The patient actually feels like they're breaking a sweat, because a lot of times people come into PT and they barely feel like they do much.
That they got much done.
So this, you can actually feel like you got a little bit of a workout.
Yeah, so let's get into some of the resistance range here. Let's say we're starting you easy. And, just kind of getting going, range of motion, getting the shoulder joint moving. And then I'm going to crank you up from a chair. Okay, because let's look at like adaptive athletes. They are some of the most in shape people I've ever met in my entire life. And they solely rely on upper body. So being able to do this, hard from a wheelchair, is critical for them. And so often they're limited in what kind of cardio upper body workouts that they can do. And from the seated position, we can get up your heart rate up pretty high.
Definitely.
Let's say, turn the resistance up even a little bit more. And what are you kind of feeling in your trunk and in your shoulders from a seated position? Right,
so from the seated position, I have to maintain, I'll keep going here. Gotta maintain a little bit of a forward lean, right? I can't necessarily be in a bad posture while I'm using this. And I have to control how much I'm rocking side to side.
Which is core.
Right, you're gonna be using your trunk stabilizers. I always like to tell patients, pick out a point, and I usually use the belly button, and you're trying to keep that belly button as still as possible. But for this, I would also think about like where your ribs meet. It kind of, it's called your xiphoid process. You want to try and think about keeping that as still as possible as you move too, and that will help you engage your trunk too.
Okay. So again, if you can stand, the preference is to stand when you can stand. But so many reasons that patients will need to do this from a seated position, and this is a great way to do it. So we showed the position of sitting in a chair. Adding an exercise ball adds some complexity where people really have to focus on their core. Maybe you can walk us through, how to use it on an exercise ball, what muscles you're using, and why you would do that position.
Right. Again, I just think it adds another step up. I mean, with regards to your arms, it doesn't make that much of a difference with your, if you're sitting in a normal, solid chair versus on the ball. Now, what I have to control is my trunk a little bit more. I'm a little bit more unstable here. If I do things like I'm gonna lift one leg, can I prevent my body from shifting side to side as I'm using my arms? And you're just gonna get a little bit more of a core workout with that, and making sure that you're trying to connect the core to your upper body. If you just do things where you're not focused on that, it will not link by itself.
Yeah, absolutely, absolutely. It's a great way to incorporate the core and your whole trunk into upper body workout altogether. Awesome.